Hi, everyone. Happy Wednesday. Happy almost end of February. I think we'll go ahead and get started. It looks like a lot of people have come in through the waiting room and everybody else is going to be trickling in. So I'll start us off and share my screen. Okay, like I said, happy Wednesday, and thanks to everyone who's joining us today for our webinar on public health legislative priorities for 2024. I'll introduce myself in a second, but in the meantime, it would be great if everybody here could introduce yourself in the chat and share whatever you'd like to share. You can use the chat to share your name, your pronouns, what organization you're representing today. And in the meantime, I'll introduce myself. So my name is Jordan Wolf, and I use he, him pronouns. And I'm the government relations manager here at the American Public Health Association. And I live in DC, and it is gray and hazy, but beautiful outside today here in DC. So moving right along, looks like we've got some people introducing themselves in the chat. Thanks, everybody. I'm gonna have a nice social little webinar today. Next up, advanced my slide. There we go. Before we get to the bulk of the webinar today, which is some very exciting and knowledgeable and expert speakers that I'll be introducing in a little bit. First, I wanted to talk a little bit about the advocacy and policy work that we do here at APHA, which I'm sure many of you are very experienced with, considering that a lot of you are affiliates. And in the sign-up link for the webinar, a lot of you indicated that you have a very advanced or already expert level knowledge of how kind of legislative and policy affairs work. But I wanted to start talking about some of the federal advocacy that we do. I work on that along with my colleague, Dawn Hopper, who I'm sure many of you have heard from both of us on some of the work that we do. The federal advocacy work that we do involves a lot of lobbying to Congress, as well as letters submitted to agencies or weighing in through court cases on some of our policy priorities that often include things like public health funding in the current appropriations process, working on gun violence prevention, climate change, nutrition issues, and a host of other issues that are encapsulated in our priorities or are often requested by a lot of our member sections. Dawn and I also work on member advocacy efforts, various ways that we can help you guys get involved in grassroots efforts like the use of action alerts or our Speak for Health campaign that happens every year. In addition to that federal advocacy work that happens here at APHA, APHA also houses a Center for Public Health Policy, which works on advancing evidence-based policies and practices on many different issues, such as racial equity, environmental health, and school health. We also have a Robert Wood Johnson Foundation funded project on public health authority. So as you can tell, there are lots of exciting things happening here at APHA. So next up, I'm going to talk a little bit about the importance of advocacy and policy work. But before I do that, I wanted to give you guys another opportunity to use the chat. We're going to really put our chat to hard work today. So while I start talking about the importance of advocacy, I'd love for you guys to drop some examples in the chat of what you're seeing happening in your own states and localities, what's being introduced in the legislatures, what's being passed in those legislatures, what are the hot topics, and what are the controversial topics around public health that you're seeing in the areas where you work and live. So please drop those in the chat. And while you're doing that, I'll talk a little bit about the importance of policy and advocacy, not just the work that we do here at APHA, but some of the work that you guys are doing and some of the power that you have in doing that. So like I said, there is some policy and advocacy work happening here at APHA, but we're in DC and we have a very DC perspective and DC geography. And one of the huge strengths that many of you have as public health experts and APHA affiliates across the country is exactly that. It's your geography. You live in cities and states and communities and counties and towns where we don't necessarily have that same reach. So not only do you live there, but you work there, you do research there, and importantly, of course, you vote there. So there's a huge potential for the work that you guys are doing as public health experts to reach that audience of policymakers and government officials who are much more willing to listen to you, considering that you do live and vote in their districts, whether that is a local government official or a state official or somebody who sits in Congress in DC here with us. So they're much more willing to listen to you sometimes than we are. And that's why, well, not than we are, than they are to listen to us because we live here in DC. So it's really important that you guys use that incredible experience and expertise in the public health field that you have to kind of advocate for what we know to be important and healthy public health policies to those government officials at every level of government. So now that I've walked through that a little bit, I'd love to see what you guys are talking about in the chat regarding, let's see, tobacco. Okay, yeah, lots of stuff happening here as well at the federal level. Maternal and child's health, vaccine issues. Okay, so it's interesting, a lot of the things that you guys are talking about, the state and local level, are very similar to things that are happening at the federal level, which kind of just drives home the point that we, align on these issues and work together on a lot of these issues that are simultaneously happening at every level of government. And we'll keep looking at the chat throughout this to get a sense of what you guys are talking about. But it's great to see that you guys are engaged in the places where you live and what those legislatures are working on. So just to reiterate, you guys do hold a massive amount of influence over the policies that are being set at the local, state, and federal level because of where you live. Now, I'm going to go to the exciting part of the webinar, which is getting to our speakers. And before I pass it along to them, I'll just do some quick intros. So first up, we have Maggie Davis, who is the Director of State Health Policy at the Association of State and Territorial Health Officials. Maggie is experienced in providing expertise on public health emergencies to federal, state, and local government entities. And in her current role, oversees the Association of State and Territorial Health Officials State Legislation Monitoring. After Maggie talks with us about a few things for a little while, we'll hear from Leslie Zellers, the legal team co-lead for the Local Solutions Support Center, a national hub that coordinates and creates efforts to counter the abuse of preemption and strengthen local democracy. She also serves as the project manager for ACT for Public Health, a group of organizations and experts applying their decades of experience in public health law and policy work to help push back against legislative attempts to block public health officials' ability to do their jobs. And closing us out today will be Omi Amarasingham, the Deputy Director of the Massachusetts Public Health Association. Omi joined MPHA as Deputy Director in 2022, and in that role, oversees the organization's legislative and policy priorities, including local public health infrastructure and investments in social determinants of health, including public transportation access, environmental justice, housing justice, and food systems. So with that, I'm going to pass it along to Maggie to get started. Take it away, Maggie. We're excited to hear from you guys.
Great. Thank you, Jordan. And I think you can advance 2 slides to start off with. So we got this one. So good afternoon, everyone. My name is Maggie Davis with the Association of State and Territorial Health Officials. Really happy to join you today to talk about some of the legislative issues that ASTO has anticipated to see before the state and territorial legislatures in 2024. Just kind of as introduction for those, Maggie Davis, she, her pronouns. I have brown hair, fair skin, wearing a blue dress with a kind of white void background with the ASTO logo on it. The 2024 Legislative Perspective Series is something ASTO put out in December 2023, looking ahead to the sessions that we're currently in. This is part of an ongoing series ASTO has put together highlighting what we've identified as the top 10 public health legislative trends for the upcoming year. We come to this list informed by both ASTO's environmental scan. So that is an annual survey of our membership of a broad range of issues that health agencies are facing, as well as querying our legislative liaison peer network, who are the public health professionals that serve as the link between the governmental public health agency and the legislature. And in identifying these trends, we're identifying not kind of what are necessarily the agenda priorities that is definitely incorporated in as health agencies share what their legislative priorities are for the upcoming year, but also what is anticipated from legislators and some of their priorities that may or may not be in alignment with public health evidence-based practices. So I'm going to quickly go through the 10 here. The QR code on the screen, and I think dropped in the chat, will take you to our landing page that will provide links to the 10 legislative prospectuses, which are individual documents kind of highlighting high-level topics that we anticipated for the 2024 legislative session as trends. And then there's also some links to some previous prospectuses in the series. So we've had the series for at least the past 5 or 6 years, so you can see a few older ones in the background. A note for those of you that have seen our legislative perspective series in the past, we kind of restructured some of the topics this year based off of priorities we had heard from our members. But a lot of the same issues remain the same. For example, in the past, we had a perspective specifically on immunization, and this year it has been incorporated into our broader perspectives on preventing the spread of infectious disease, which we'll get to in a minute. But a lot of those core topics, health equity, and some other things are really flowing throughout or kind of just restructured throughout the prospectus. So to kick off, if I got the next slide, please. Wanted to start with talking a little bit about the public health workforce and healthcare workforces. This is a topic that has been of great interest both for public health officials as well as legislators, as we've seen some real struggles in recruiting and retaining qualified public health talent and healthcare talent. So in 2023, we saw some really exciting gains in sustained public health funding, most notably the state of Indiana, after a 2-year kind of effort of assessing their core public health foundational public health services and kind of thinking through how their public health service should operate, enacted Senate Bill 4, which greatly increased their local investment in local public health. So that was a huge win, and we're continuing to look at states seeing efforts to find funding increases for aspects of public health services. And so far in 2023 or 2024, we've seen at least 4 states, Colorado, Delaware, Maine, and Washington, have proposals to increase investment in certain areas of public health, particularly some efforts in increasing investment in behavioral mental health, as well as some in increasing the capacity of public health laboratories. We've also seen a big focus in supporting the healthcare workforce. We've heard this for years, that there's been shortages of key positions, and we're starting to see a lot of states really look at programs to encourage, say, operating in rural areas, as well as kind of looking at the system as a whole. For example, so far in 2024, we've seen in Arizona, they're considering a bill that would create a healthcare workforce advisory council to address workforce shortages and make recommendations on how they could better train upcoming healthcare professionals. Next slide, please. So shifting a bit to one of the next topics, and I should mention, these are not in a priority order. All 10 are very important, but we are kind of focusing a bit more on 4 or 5 here that we've just seen a little more movement so far in 2024. So mental health has been a huge focus across the nation, including to policymakers. In 2023 and looking into 2024, we identified a few kind of subcategories within mental health that we expected to see some work in and have already seen some progress. One is in particularly focused to youth mental health with a special call out on looking at eating disorders among youth. So in 2023, we saw more than 7 states considering legislation on youth mental health and eating disorders, with Colorado enacting a law to create a disordered eating prevention program within the state health agency. So far during this session, we've identified at least 12 states with bills related to youth mental health, including raising awareness of eating disorders. And one of the interesting kind of intersections of both of these is some of these bills really encouraging healthier social media use to encourage youth mental health and or raise awareness or address eating disorders. Another area, and this has been something that we've really seen legislators very interested in, has been the therapeutic substance use to treat mental health disorders. This is particularly looking at the holistic or cultural practice of using psilocybin and applying that to certain mental health disorders such as PTSD, clinical depression, and some other areas. So we've really seen a focus on psychedelics. In 2023, we saw at least 24 jurisdictions with legislation to either decriminalize or support therapeutic use. So far in 2024, we have seen 15 states considering legislation to have therapeutic use of psychedelics expanded past psilocybin to include things like MDMA or LSD, and then a few task force focused on therapeutic programs. And should definitely note that at least 2 states have had voter referendum to create therapeutic programs, with Oregon being the first one in operation that started last year. And then lastly, and certainly not least, we've seen a big focus on suicide prevention and enhancing crisis supports. So similar to the earlier slide about workforce investment, we've seen a lot of investment in the crisis support behavioral health workforce being considered among legislatures, as well as a big look at suicide prevention. And one area our team's been really looking at as a method of suicide prevention is reducing access to lethal means. And one of those tactics has been safe storage of firearms. And we have a blog post that, if you scan the QR code, goes into a little more detail of some recent policy changes on safe storage laws. Next slide, please. So this next area is one that I think a lot of people on this webinar is very interested in, and definitely one that has caught a lot of attention among public health leaders and some understandable concern. So we are really looking at that, containing the spread of infectious disease. So those core public health powers such as isolation and quarantine and immunization. In 2023, we saw several states consider legislation to remove or further erode isolation and quarantine powers. We saw a few laws passed early in the pandemic that challenged some of those public health authority powers. For example, in 2021, Ohio enacted a law that really weakened some of the ability for public health to issue isolation and quarantine orders, which did have an impact during last year's measles outbreak. We're seeing a few bills across the country that continue to question some public health authority. Wanted to call it for this session that we've seen concerning bills in at least 2 states, Kansas and West Virginia, that would curtail existing public health authority to issue isolation and quarantine authority. And in particular, the bill before the Kansas legislature did pass the House earlier this month. So that is one that we're watching very closely. And then another area is protecting and encouraging the use of routine childhood immunizations. As many of us know, having high immunization rates of the recommended childhood immunizations really does protect overall public health, and in particular prevent things like measles outbreaks that we've seen really starting to pop up in some jurisdictions across the nation. So far this year, we've identified at least 15 states with bills related to those routine childhood immunizations. And the one wanted to kind of lift up here that we're watching is a bill in West Virginia, HB 5105, which would add a religious exemption to its school immunization requirements. Also passed its first chamber this month, and West Virginia for a long time was one of the handful of states that did not have any non-medical exemptions to their school requirements. So if this bill were to succeed, it would greatly shift the policy landscape for vaccines in West Virginia. And then lastly, this is something somewhat on the proactive side that we've really been monitoring, is addressing public health mis and disinformation. The Surgeon General, I think in 2021, issued a report about the effects of mis and disinformation and some strategies to promote against it. In 2023, California enacted a law to really put in place one of those strategies, which is to encourage science and health information and literacy. So moving forward, California public schools will include science literacy in their curriculum, which is an exciting kind of step forward. So far this session, we did see at least one bill in New Jersey considering making the spread of health misinformation or disinformation by a licensed healthcare professional to be grounds for disciplinary action. Next slide, please. As many know, another big topic within public health, we continue to struggle with an overdose crisis as a country and have seen a lot of efforts policy-wise to reduce overdose, both fatal and non-fatal. We've seen states consider legalizing fentanyl test strips. One interesting bill so far this session is that one state has a bill to legalize harm reduction vending machines to further encourage the distribution of fentanyl test strips and opioid antagonists, as well as investments in peer support for people that are recovering from substance use. Next slide, please. So for time, going through a few of these pretty quickly. Another big trend that we've been seeing is an increase of sexually transmitted infections, particularly related to congenital syphilis. We've seen at least 7 states during the 2024 session so far have bills related to syphilis testing during pregnancy to either increase the frequency or to encourage broader testing by different providers. To hopefully identify syphilis cases and treat them perinatally so that you reduce congenital syphilis rates, as well as some efforts to continue expanding access to HIV prophylaxis, either pre-exposure or post-exposure. And then for family and reproductive health, there's some more information within the prospectus and topics, but a few to call out so far for this session. We have seen a big focus in increasing contraception access. Federally, there was an exciting move of the FDA approved its first over-the-counter birth control pill in 2023. So we're still seeing some efforts, though, to encourage access to prescription contraceptives, including allowing a 12-month supply to be dispensed at once. With so far in the current sessions, at least 25 states have bills considered to allow this. And then some interesting bills related to maternal mortality and morbidity, with at least 2 states having bills related to dignity in pregnancy and childbirth. Next slide, please. So moving quickly to a few more topics, very important. And this actually I saw in the chat, some of our environmental health topics and food safety. We have seen a lot of these quote unquote food freedom bills or efforts to expand cottage foods or foods produced by small producers outside of commercial kitchen. That is something that we've been tracking very closely. We've also seen a focus on enhancing lead surveillance and lead abatement. The EPA reduced the blood lead levels of concern rate a couple years ago. So we're starting to see state policies catch up to that new standard from the federal government. And then also related to tobacco and nicotine, we continue to see states consider bills banning flavored tobacco products, including prohibiting menthol products. Next slide, please. All right. In the quick final call out from the last 2 prospectuses, focused on public health data sharing and privacy. Interesting bill in Florida right now to require hospitals' electronic health records to be available through a nationally recognized trusted exchange framework, and wanted to point out the TEFCA agreement. So I believe that's the Trusted Exchange Federal Common Agreement. I might have just messed up that acronym. But if you go to the QR code, my colleague Lillian Colasurdo and Alex Woodward put together a great overview of what this new federal framework is to help facilitate interjurisdictional data sharing, which may have implications in a number of program areas. And then lastly, within our Optimal Health for All prospectus, which really is kind of overencompassing of several health equity issues. Wanted to call out some interesting efforts to collect health disparity data that we're seeing, particularly a bill in California that would kind of bring together some environmental and public health data on the health impacts of wildfires. So moving on to the next slide, just wanted to give you a quick overview of the 10 topics, and then you can get the contact information for us here at ASTO. Again, we provide a lot of legislative monitoring and then technical assistance and support to the state and territorial health agencies, particularly in how they relate with their legislatures. But with that, I think we're going to move on to Leslie, who we've worked with as part of ACT for Public Health, to share a little bit more on preemption, some other topics.
Thanks so much, Maggie. Woo, you covered a lot of ground there. That was really informative. So I'm here today wearing two hats. I'm going to talk to you about preemption-related bills for the Local Solution Support Center, and then I'm just going to quickly give you a little information about what ACT for Public Health is doing. And feel free to contact me directly for more questions about any of these topics. Next slide. Oh, also, I wanted to say, just for those with visual impairments, I'm a white woman. I have dark brown hair. I'm wearing glasses and a blue and white striped shirt. So just to kind of do some level setting here, preemption, I think most of you on this call are pretty familiar with the legislative process, but basically preemption is when a higher level of government makes it impossible for a lower level of government to act on a particular issue. That can happen with the federal government and states, but generally for our purposes today, we're talking about when a state government restricts the ability of a city or county to act on an issue. Next slide. Not all preemption is created equal. Preemption is in and of itself a neutral tool, but it has not been used that way historically. Dating back to Reconstruction, preemption has been used as really a form of oppression against BIPOC, LGBTQ populations, women, immigrants, and working people. So preemption can be used for good or it can be used for bad. Next slide. So within LSSC, we're not looking at all preemption because there are some types of state preemption that are actually furthering public health or furthering workers' rights. We're looking at specifically the subcategory of abusive preemption. And that's when the state government is taking power away from local governments. Usually it's done in a way that is perpetuating harmful or oppressive systems? Is it excluding in some way or removing power from BIPOC, LGBTQ people, women, immigrants, and working people? And I say that's a subcategory of preemption, but as you will see, it's a rather large subcategory. Next slide. So for those of you who aren't familiar with LSSC, we are not an exclusively public health focused organization. We do work on public health issues, also on worker and economic justice. Because it's an election year, we're looking a lot at preemptive laws relating to elections and voting rights. I saw some of you put in the chat things like parental rights. So how are local governments able to control decisions around curriculum? I'm going to talk a little bit more about LGBTQ rights. And we're also seeing an effort on the part of conservative state lawmakers to curtail the authority of local prosecutors to use their discretion to act as they were elected to do. Next slide. And the next one. So LSSC is a national hub. We work in a variety of mediums. We have state-based campaigns that are helping to counter preemptive bills in different states. We're also available for communication support. We have a number of papers on our website. I think, oh yes, Raya, who's on top of it, already put the website link in the chat to some of the white papers, and there are also research papers that I encourage you to take a look at. Next slide. And next one. So in 2023, LSSC tracked 682 abusive preemption bills, which is a really large number. Not all of those were passed, thankfully. My legal team co-lead at Brianne Shell and I are tracking bills in 2024. So far, we found about 200, but that is not exhaustive. So I imagine we're going to get pretty close to this number as well. Next slide. I want to talk about two issue areas in particular. This is something that we've seen as a trend for the last several years, is criminalization of homelessness. Many local governments, particularly urban local governments, are trying to address the crisis of homelessness and looking for ways to provide housing for people, to provide other social supports. And the Cicero Institute, which is a conservative think tank based in Texas, has been promoting bills to essentially criminalize homelessness, make it a crime to camp in a public place unless it's a state designated camping space, or sleep in your car, or any of those kinds of activities that you might need to do if you don't have a place to sleep. And this could be enforceable by criminal penalties, a fine, incarceration, which is of course only adding to the problems of homelessness, and requiring local governments to provide additional beds, which is a goal of all local governments, but may not be possible within their particular jurisdiction. And basically, it removes the power of local elected officials to make decisions for their own population. We've seen these bills passed in the last few years in Texas, Missouri, Tennessee. This year, we're already seeing bills in Florida and Kentucky on this topic. So this is a trend to watch. We're also seeing other housing-related bills that are being introduced that would basically insert the state in issues that have been predominantly the province of local government. So governing landlord-tenant relationships, what landlords can and cannot do with respect to tenants, governing how local governments are regulating vacation rentals. These topics that have really been traditionally local issues, we're starting to see states interfering with them. It will come as no surprise to you that the most frequent state on our bill tracking so far is Florida. They have by far the highest number of bills related to preemption that we're tracking so far. Their legislature wraps up in the next week or so. Okay, next slide. Another trend, I saw a number of you put this into the chat. We are seeing a continued onslaught of bills that would restrict the ability or create a more hostile environment for LGBTQ adults and youth. Some of the main categories are prohibiting gender affirming care for LGBTQ youth. Some of these are not strict preemption bills, but some would actually prohibit healthcare professionals who are employed by the local government to provide this care. We are also seeing restrictions on what school districts can provide in their curriculum about LGBTQ topics, either an outright ban on certain kinds of curriculum or parental consent required. We're seeing prohibitions on transgender athletes participating in certain sports. And I think related, well, this slide here talks about in 2023, we saw more than 500 bills, and at least a third of them had some form of abusive preemption, which is a technique that state legislatures are using. I think related to this topic, it will come as no surprise to those on the call that we're also seeing a lot of bills related to abortion in the wake of the Supreme Court decision in Dobbs, restricting how local governments can fund or pay for abortion services. Next slide. We are going to be putting out a report on trends already in the 2024 legislative sessions. Now that we're 2 months in, you can take a look at some of the highlights in the 2023 legislative session overview from last year. Next slide. And we have, as I mentioned, we have a lot of papers on our website. You can see in the bottom center of the screen, the most recent papers on preempting LGBTQ rights, but we have papers on other hot topics, including election administration and criminalizing homelessness. Next slide. Here is some contact information for us. There's a really great email list. Comes out twice a week. You get news clips, you get bill highlights. There's a weekly briefing, so I encourage you to join that. I will put my personal email in the chat. If you have any questions, feel free to reach out to me directly. And I'm going to take off my LSSC hat, my imaginary hat. I'm going to put on my Act for Public Health hat. So next slide. Just want to touch on a couple topics. For those of you who don't know, Act for Public Health is a consortium of public health law organizations. You can see the logos at the bottom: Change Lab Solutions, the Center for Public Health Law Research at Temple, the Public Health Law Watch at Northeastern, Public Health Law Center, and the Network for Public Health Law. And this was really formed in the wake of COVID, as we started to see these bills that you heard Maggie talk about, limiting local government authority on core public health functions about communicable diseases, including quarantine and isolation, which we are still seeing bills on. I'm really just surprised that we are continuing to see these kinds of bills. So next slide. One of the issues that Act for Public Health is tracking, Maggie touched on this, we work very closely with ASTO on this, but I wanted to just highlight vaccines because that's an issue where we're continuing to see probably the highest number of bills introduced. Vaccine-related issues predate COVID. There was a large anti-vaccine movement in the US. COVID was a platform that many of those advocates could use to loosen vaccine requirements. And so these kinds of bills we expect to see continuing. They're not COVID specific. Here's a map which shows, it's a heat map, so the darker the color, the more bills. West Virginia, for example, had the highest number on this. These are bills that would expand non-medical exemptions or change the authority for who gets to control vaccine requirements away from the health department. If you look at the next slide, there are also positive trends in the vaccine bill space. We are seeing bills that would add vaccination requirements for school entry or limit the non-medical exemptions or add specific requirements or expand scope of practice so additional healthcare professionals can administer vaccines. So that's also a really positive trend. And next slide. I also encourage you to join the Act for Public Health mailing list, another excellent mailing list. We do not spam you on that one. We are very judicious and we have webinars and other resources that are, I think, really helpful on this topic. And I'd be happy to talk with anyone offline about any of these issues in more detail. Other than that, I will pass it on to our next speaker.
Thanks, Leslie. Hi, everyone. My name is Omi Amarasingham, she, her pronouns. I'm the Deputy Director at the Massachusetts Public Health Association. I have brown skin and black hair, a navy blue shirt, and red framed glasses. I had to check. Nice to be with you all today. I'm just going to give a quick overview of some of the work we're doing here in Massachusetts, specifically on local public health infrastructure and our bill on that topic and where we are in budget season here in Massachusetts. Thank you, Raya, for putting our MPHA's priorities for this legislative session in the chat. We are a nonprofit advocacy organization. We are the Massachusetts affiliate of APHA, and we spend most of our time on state level policy work, trying to move healthcare upstream, trying to get greater investments in the social determinants of health, and trying to shore up our local public health infrastructure. So focusing in on that last topic, Massachusetts is in a different posture in a number of ways from other states, as we've just heard, but one of those is that we are a very local control state, and that is in large part because the towns and cities of Massachusetts were incorporated before the state and federal government were. And so the upshot of that is in Massachusetts, we have 351 separate local boards of health, one for every town and city. Everyone has their own. And then there is the State Department of Public Health, and there's nothing in between. And at the local level, historically, there has not been any state funding for public health. Public health has just been funded by the municipal tax base of any locality, and that has meant that the city of Boston has great public health services, and the other 350 towns and cities have very little to no public health services and may only have volunteers who are on the Board of Health who may or may not have any training in public health at all. They may be real estate agents or just engaged citizens. And actually, one thing we are starting to become worried about is that anti-vaxxers are setting their sights on local boards of health and may try to insert themselves into those positions. So MPHA, along with our partners in Massachusetts, have been engaged in a multi-year campaign to shore up our local public health system and get sustainable state funding so that every resident, no matter where they live, can have access to basic public health services. So the slide here gives a quick progress report on where we've been and where we're going. So in 2019, really just before COVID hit, a stakeholder group came out with a blueprint for public health excellence to incentivize cross-jurisdictional partnerships and regionalization of local public health and create a sustainable funding mechanism from the state for local public health delivery. That then was translated into a bill that was passed in 2020 called State Action for Public Health Excellence Act. SAPHE is, believe it or not, pronounced SAFE. So SAFE 1.0 was our first bill that was passed. That created the structure that we have now, where I think it's 320 of the municipalities in Massachusetts are in cross-jurisdictional shared services agreements, working together to share funding and share staffing to more equitably and efficiently deliver local public health services. So we have 50 partnerships, and the majority of the state is covered by those partnerships. In 2020, COVID, of course, was a horrible thing, but it did shine a bright spotlight on the cracks in our local public health infrastructure, and that gave us some momentum to get state funding for the very first time. So in 2020, the state legislature gave all of the 351 municipalities, I think it was $5 million to share amongst themselves to beef up their public health services. And that was the first amount of funding anyone ever got from the state. That line item has now gone up to $15 million annually, and we will be pushing for that to continue to increase. In addition, in 2021, we secured a huge ARPA investment in local public health infrastructure of $200 million. The next step, which has been the hardest to get through, is SAFE 2.0, which would set Massachusetts on a path to adopt foundational public health services, which would then grow the responsibilities and the training and the workforce pipeline for local public health. And as a result, hopefully grow the amount of money that the state contributes towards local public health services. Next slide, please. So this is a quick overview of what the bill would do. I won't read it out loud, or actually maybe I will read some of it out loud. It basically does four things. It establishes minimum public health standards. Those are the foundational public health standards. It would create a uniform data collection system. That work is underway. It would increase capacity and efficiency through cross-jurisdictional partnerships and increase equity through state funding so that your local public health delivery was not based on the size of your municipal tax base, specifically the commercial tax base. So we came extremely close to passing this bill 2 years ago. It got unanimous votes in the House and the Senate, but the governor at the time did not like it, and he vetoed it. And for procedural reasons, the veto was not overridden because our legislature was out of session and didn't come back to do veto overrides. So we are back at it again. Massachusetts, in its specialness, has an 18-month legislative session. So we are actually right now in the last half of our legislative session that started in January 2023. And this is the time of year from now until July 31st, when things actually move in the legislature. In Massachusetts, the default posture is that nothing advances. And on the one hand, that means we don't have to engage in that much defensive work, unlike many of you, based on what I'm seeing in the chat. But on the flip side, it means that it is a Herculean effort to get anything to move across the finish line. And so we are our bill has advanced through 2 committees. It's now waiting to be taken up by the House and the Senate on the floor. We hear that that is a thing that could happen any day now, although I think functionally we're not really expecting it to happen until probably the absolute last hour of the last day. At the same time, we are in our fiscal year budget cycle. We are, I think, like many states, concerned that this is going to be a belt tightening year as ARPA and CDC infrastructure funds and other federal pandemic relief funds start to expire and legislatures become anxious about where that sustainable funding is going to come from. So we are sort of guarding ourselves for cuts across the board. We really hope that the cuts don't come to local public health. The administration proposed a $6 million cut to the $15 million line item that we have. And so we will be working with the legislature to try to help them see the importance of investing in public health. But I think, we're seeing it's a tougher sell in Massachusetts, especially as public health has fallen out of the headlines as COVID has gone away, and the anti-vaccine movement in Massachusetts exists, but it is not that strong. And that sort of perversely has meant that because we are not in the headlines, we're not getting that much attention in the state house. And so our task is to continue to remind people that COVID was a thing that happened, and we had many regrets about the state of our local public health system. And now is the time to invest so that we are ready to meet the public health challenges of today and tomorrow. But we'll see if and when that is responded to by the legislature. The last thing I'll say, I just wanted to touch on a couple other things that have been mentioned that we are working on in Massachusetts. Housing justice is a big issue for us. In particular, we're trying to get rent stabilization measures passed. We have a long-standing sort of state preemption rule about rent stabilization where towns and cities are not allowed to enact rent control measures. And so we are trying to lift the statewide ban on rent control. We are working on overdose prevention centers and trying to authorize those for Massachusetts, and public transportation access outside of the Boston area as an important social determinant of health. So I think that I will leave it there. I'm sure I'm past my time, and I will pass it on to whoever's next. Thanks.
Okay, everybody. Thanks so much to all of our incredible speakers. That was super, super informative. I know I feel more in the loop now, hearing what you guys have been tracking and working on at lots of different levels of government and policy. So at this point, we just wanted to give you guys some leave behinds and some opportunity to check out some materials that can kind of boost your own advocacy and grassroots efforts. So in terms of steps for your own getting involved in advocacy and policy, some things you guys can do after this meeting, later this week, later this month, throughout the entire year. One is to just be informed. A great way that you can do that using some of APHA's materials that we have available. We post all of the things that we're working on our website, both from the policy center as well as advocacy related. In terms of government relations, we post all of our letters that we send to Congress, all of the comments that we join to agencies on our advocacy tab. And if you're an APHA member, you probably also receive a legislative update from us that just goes over some of the public health things happening in the legislative space. So that's a good way to stay informed. And in terms of tracking legislation, just being aware of what happens, whether at the state level or what's happening in Congress, is a great way to keep a finger on the pulse of what's happening in the public health space. So you can do that. A great way to do that at the federal level is paying attention to various important committees. So like the Energy and Commerce Committee in the House or the Senate Health Committee are going to be two great ways to pay attention to what health legislation is passing. And then as well, just keeping an eye on what's happening in your state and local legislatures can keep you in the loop. And finally, just be an advocate. Look out for opportunities to get involved not only be aware of what's passing, but obviously, as some bills have been mentioned by our speakers, like the bill that Omi just mentioned that was in their legislature, when you do see a bill that from your own public health expertise is a good bill and would be good for the health and safety of communities, advocate for that. Whether it is maybe something at the federal level, going on APHA's website and sending an action alert, or writing an op-ed on that bill and submitting it to your local paper, or taking action on social media. There's a lot of different ways that you can be an advocate. And there are some materials that we can share as well. So here are some resources from APHA, as well as from some of the organizations that our speakers work with, such as materials that we share on our Speak for Health website, the Act for Public Health email list, legislative alerts, legal resources. I believe that these slides will be shared after the presentation is over. So you guys can click away when you see those links and use those as a way to do what we talked about on the last slide, which is stay involved, track legislation, and get involved in advocacy. So I think our last slide, we will take some questions and comments. So a lot of you submitted questions before the webinar. Thank you so much for that. And now that we've heard from the speakers, if you have more questions based off of what they discussed, please go ahead and throw those in the chat and we will read through some of those. We'll start with one that we got in the sign up for the webinar. And one of those was, what method or methods did you use to analyze and forecast the 2024 priorities? Does anybody want to answer that question? Maybe Maggie?
Yeah, I mentioned this a little bit in starting the overview, but we have an environmental scan that our team puts together looking at kind of overall needs and state of the health department. So we used a little bit of information from that, but then also working with our legislative liaison peer network to get a sense from those professionals on the ground that both kind of see the priorities of their health department, but also hear from the legislature of what their priorities are. So from those sources and a few other, like our own legislative tracking, is what kind of came together to identify the top 10 trends and issues.
Awesome. Thank you so much for that answer. That's super helpful. Another thing I saw listed in the submitted questions that I thought could be kind of interesting is, what are some issues that you'd like to see state legislators educated on prior to the legislative session coming up next? So maybe, you know, we see what's happening, we see what's being introduced and voted on, but for any of the speakers, are there any things that you feel like maybe it'd be helpful if the state legislators had more information, maybe from experts like you guys? Anybody have thoughts on that?
Well, I'll start off generally, and I think, I don't know who put this in the chat, but elected officials still need more education on the value of public health, I think, and that's not lobbying, that's straight up education. Why do we need public health? The Act for Public Health, we worked with BMSG, Berkeley Media Studies Center, on some messaging around this, and the analogy they created is, you don't get rid of your fire trucks and your fire department when there isn't a fire, because when the fire happens, you can't build a fire truck and go out and issue a hiring notice. You have to be ready. And so I think all of this reallocation of authority to the legislature on these decisions, just kind of helping to remind them of the core public health functions that they value, that, you know, that are not controversial. I think that would be really important.
That's super helpful. Love that answer. So I see two similar questions that were submitted earlier in the signups, and they're kind of related. So one is, how can we motivate more people to advocate and be advocates in the public health space? And two, very similar, what are some ways that younger people can get involved in the legislative process when they feel pushed out? Anybody have thoughts on those?
I'm happy to jump in on the first question about how to get more people to advocate. I think in my experience at MPHA and also previously at the ACLU, making it extremely easy. The easier you make it for people to take action, I think the more likely they are to do it, including demystifying the process. People are very, I find, often anxious about advocating, both because I think people are, the State House can be a scary place. It's very formal. It's very intimidating. The process can be opaque and hard to navigate. In the public health space specifically, I know folks are worried about compliance. Are you lobbying? Are you walking up against lines that you shouldn't be walking up against, especially if you live in a place where you may become a political target for doing the wrong thing? And so I think being at MPHA, we try to be available to demystify the process, to answer questions, to point people in the right direction, to understand where are those lines when you are a 501c3. Do you use your H election? And then at the individual level, to again have call scripts, talking points, remind people that they are their own experts and their own experience and expertise is really valuable, and that legislators, most of all, in my experience, want to hear from quote unquote real people and don't really want to hear from the lobbyists or the advocates nearly as much. And so that there is a lot of power there as well, and that your voice does make a difference.
Love
Yeah,
that.
Yeah, I don't know if I can find the link in the next 2 minutes, but I will try to put it in. The Network for Public Health Law has a really great project on strengthening public health advocacy. And Umi is exactly right. I mean, if young people, or I used to work with Coalition of High School Students, boy, do your city council members sit up and pay attention when high school students walk in the room. They put their phones down, they look up. So your voice matters. And I think starting locally is the easiest way to do it. I mean, I used to work in tobacco control. There's always a tobacco control coalition. You can look on your local health department website, and sometimes they do it in high schools or community colleges to have a nice, easy entry point for that.
Awesome, thank you. I think that's probably all the time we have for questions, but I think Leslie, that was a great final point to put out there, is that your voice does matter, which is, one of the things that we're hoping to get across in this webinar is that whether you're engaging at the local, state, or federal level, getting involved in a lot of these issues that have been discussed today is something that you guys have both the expertise and the geographic ability to do for a lot of different members of legislatures to kind of use that to your advantage and kind of change the landscape of what's happening and push for policies that we know are good and need more people pushing for. So yeah, your voice matters. Well, thank you so much to everybody who joined us today for this incredibly informative webinar. I know just as the moderator, I learned a lot from our superstar speakers. And thank you so much, Leslie, Maggie, and Omi for joining us today. And thanks everybody for giving us your Wednesday afternoon. Like I said, these materials will be shared, so look out for that. Click all the links, check out all the super useful links that were in this PowerPoint. And everybody go get involved in advocacy this 2024. Thanks so much, everybody. Have a lovely rest of February.